This podcast is for entertainment purposes only and does not substitute for professional medical advice. Please seek a medical professional or healthcare provider if you're seeking any medical advice, diagnosis, or treatment. Thanks, everyone.
Welcome back to Funny Medicine.
I'm Evie.
I'm Julie.
And this is our show.
And this is Measles Part 2.
Yes, Measles Part 2.
We didn't plan on measles being more than one episode, but
Yeah.
I mean, it's just such a heavy...
It's good conversation.
Yeah, and there's so much to talk about it right now, unfortunately,
Yeah.
realistically, unfortunately, that we're just like, you know what, let's just make this a Part 2 because, I mean,
Exactly.
there's too much. Anyway, so we left off to start in a pretty big and relevant moment of it right now, I guess you could say. I'm not really sure what the wording would be about it, but it's vaccine hesitancy and the psychological and social problem that vaccine hesitancy is causing today
Yeah.
in relation to measles. There's so many the problem is that it's not only measles, it's so many other things that you're putting yourself at risk.
You're making yourself susceptible.
That's it. That's
Okay.
the word. Yeah. So you're making yourself susceptible by not taking all these other vaccines like polio, rubella, of course, measles, but then there's also mumps, whooping
Pertussis.
cough.
Yeah, exactly.
You know, just by not taking, it's such a mess.
Yeah.
It's such a mess skipping out on these vaccines. Now we're opening up a can of worms by allowing all these other infections to have a possibility of coming back,
Yeah.
just like measles is doing, unfortunately.
Yep.
It's scary.
Yep.
Anyway, so why are people skipping vaccines,
Oh,
Doc?
Man, this is my daily battle. Daily
struggle.
battle. It is awful. It really is. But I'm not going to get on my soapbox about it. You can tune into our first episode, and I had a little bit of a soapbox there. But
It's needed, though.
yeah, so frustrating. But anyways, things like social media, Facebook, TikTok, a lot of mommy blogs, you know, these,
Yeah.
I feel that, and correct me if I'm wrong, but I only get to see my patients, unfortunately, sometimes 15 minutes. If there's a really like bigger problem, maybe 20 to 30 minutes. Trust me, if I had 2 hours with my patients,
Yeah.
what a world of a difference that would
course.
make,
Yeah.
right? And I think it would not only make a difference in the treatment that I provide and the care that I provide, but also the trust that I gain.
Yeah. Yeah.
Because who are you going to trust more? And let's just take away the whole entire social media is a lie and all these things.
Right.
We are on our phones all the time.
All the time.
Okay, we follow our followers, our favorite followers, and things like that. And
Yep.
then when our favorite followers that we see every day because they are posting every single day,
Yep.
you see these
Yeah.
people
Yeah.
more than you see your actual doctor.
That is so true.
you feel
Yeah.
like you have an emotional connection
Exactly.
with these
Exactly,
people.
yeah.
And then you see your doctor, unfortunately, not because we want to, okay?
Yeah.
But you unfortunately see your doctor for like about 15 minutes, and it's just a very negative feeling because you're stuck waiting. And then, you know, when you see them, it's only for like 10 minutes. You didn't address things that you wanted to address. You like only like top 3 things that are worrying about you, which is how they train us. They're like, what are your top 3 things that you want to discuss today? We'll do
Yeah.
a follow-up. But it's kind of like, it's all this like choppiness,
Yeah.
right?
Yeah,
There's
yeah.
really no fluidity in your conversation with them, and it's really tough.
It is.
And I think some physicians and practitioners have they're very gifted in the way that they flow their
Right.
office visit, that they're able to somewhat gather up everything. I don't limit myself, to be honest.
Yeah.
I have 15 minutes, but I talk about everything. I talk about nutrition. I talk about your sleep. I tell you, are you peeing? Are you pooping? Okay.
Right,
Like, are you
right.
constipated? How's school? I try my best to really get a full picture, but unfortunately, the reality of it is I don't have
Yeah.
30, 45 minutes when I have to see 30 patients a day.
Yeah. That's it. It's just the whole system is
It's broken.
It's broken because we're putting so much weight on clinicians, and there's less and less of you guys out there every day.
Yeah. So how am I supposed to gain someone's trust if I only see them once every 2-3 months when they're really, really little, and then maybe once a year. And if you have any other problems going on, maybe I can see you once every 6 months or more often. I invite you, please, like, make an appointment with me. But truthfully, that whole process is really difficult. So of course, these people feel that connection, right, in social media. So how
they feel like they know that person better.
They know that person, and like, how is that person would never betray me, right? But again, it's misinformation.
100%.
You know?
100%.
But anyways, so social media definitely has like supercharged this whole entire vaccine misinformation.
It's made groups too.
Yeah, groups and everything. It's so segregated now. And then talking about segregation and not, you know, like groups and all these things, now medicine has all of a sudden, especially in vaccines, become politics. Like, politics have become involved in it.
Oh my God. And there's people, I've had this like discussion with people on social media about like, well, of course politics has to be involved in it. I'm like, I'm not saying that it cannot be involved in it at all. But to the level that it is right now,
but again,
it's
it is
not right.
No, it's not supposed to be. Science is science. Data is data. Science can give three shits if you are a conservative or if you are a liberal.
Right.
It can give three
That's
shits.
the problem. That they're trying to politicize these things, and it's not to be politicized.
Exactly.
You know?
So that's another reason why vaccine hesitancy
of course
has come about.
100%.
Right? Because, if you're conservative, then I feel like I would vibe with your vaccine and
it's so unfortunate.
views.
It's so unfortunate how this is all like become this big thing. Like,
and then we talked about influencers, celebrities. That time when we discussed, I think it was during our autism episode, Candace Owens, that she was saying, I know a lot of celebrities that actually don't vaccinate their kids. I'm sorry. Since when is a celebrity like all of a sudden a god? Why do I need to emulate exactly what they're doing? It was absurd to hear that. It was absurd to hear that.
It's so dumb. It's so dumb to me. And then, you know what's worse? The people that use Botox, you know, but then they're against vaccines.
Yeah.
You're injecting yourself with a neurotoxin.
In this day and age, everyone is ready to inject themselves with something, and except for a vaccine.
But not a vaccine. So you want to go ahead, your vanity, for your vanity's sake, you know, so not something life-threatening, your vanity's sake. Inject yourself with a neurotoxin.
Yeah.
Okay, an actual toxin.
Yeah.
Instead of the vaccine. Make that make sense.
It does not. And they cannot.
Because they're like, vaccines have toxins in them and this and that. And I'm like, guys, what the fuck is Botox? You know, and that drives me up the wall. Like, for instance, Jenny McCarthy, super staunch anti-vaxxer.
Yeah.
I don't see a wrinkle on her face. It's just like, that's why I'm like, a celebrity, really? Like, how does that?
And then again, then it becomes like groups, right? So we're like the anti-vax group, and you believe in vaccines, you must. Then all of a sudden, just because I believe in vaccines, I must believe in other things. You know, it's just so.
It's horrible.
Pitiful.
It really is.
It's disgusting.
It really is.
It's disgusting. It's disgusting to provide someone with a recommendation with preventative healthcare, because that's what it is. It's preventative, right? We are preventing you from having a severe illness. Okay.
Yeah.
And just because of that, all of a sudden, I don't practice natural medicine.
Why do we want to go back to 100 or 200 years back? People were living less back then.
I just had a family 2 weeks ago bring their child to me because they're having this terrible cough for 3 weeks. It's only getting worse. They're starting to have fevers. And I'm like, okay. I start checking the kid. He has an ear infection. And I tell him, hey, the majority of these infections can actually go away by themselves without antibiotics. And we actually do recommend watchful waiting, right? Which means we'll watch out for these symptoms. Make sure maybe the fevers stop. Maybe the ear pain stops with some Motrin and Tylenol and all these things. So when I said, it's an ear infection, immediately, without me even saying anything, the family was already like, well, we're very natural and we try not to do antibiotics. And I looked at them, I'm like, I haven't even mentioned anything about, I just said that it was an ear infection. But again, it's that like preface that they're already, it's almost like they already come into the visit like ready for a fight.
That's exactly what I was going to say.
Right? And I told them, I said,
So
well, if you would have let me talk to you, you would actually know that we don't just prescribe antibiotics like off the bat unless you're having other symptoms that are more worrisome.
It's like, then why are you here?
Yeah. And again,
why are you here then?
I know, and sometimes I don't want to also make people feel that just because they practice a more holistic approach in medicine that they cannot come and see me, right? If you're concerned, come see me, okay? But also, like, come see me and chill out. Let's have a discussion. Don't come in and already try to like stick it to me or whatever.
I give you all the praise in the world. I don't know how you have the patience to do this every day. Like,
yeah,
it's just...
thankfully not all my patients are like that. But
still.
And I love having conversation. I promote that. I promote an educated conversation.
Yeah.
I give people my business card with my email. Send me the articles that you're concerned about. Where did you get that information?
Right.
Send it to me.
Right.
I'm still waiting. So, whatever. Anyways, again, now you have, and Florida is the religious exemptions.
Yeah.
Anyone. Let me just cut that out. I don't even want to say that because everyone's going to get a religious exemption. But anyone can fucking get a religious exemption. Okay.
Oh, boy.
So, unfortunately, because of these religious exemptions, I'm just going to say it how it is because everyone and their mother has a religious exemption.
It is what it is.
Then there's lower rates, right? So, our kids that are immunized are going to schools when we don't know, like maybe 20% of their class is unimmunized.
I hate this. I hate this so much. You know what this feels like to me? This feels like to me like a really annoying clique in high school.
Yep.
That is like super popular now.
Yep.
That's what it feels like to me.
Yep.
I know it sounds really dumb, but that's how dumb it feels like to me too.
Yeah.
It's just like this annoying freaking clique that for some reason everybody loves, and it's just like, why are we in high school again?
Yeah.
Why is this popular? Why is this trending? Why do we give a shit so much about what this freaking celebrity has to say?
Yeah.
You know, like, it's so
and
annoying
again,
to me.
why is it that measles loves vaccine hesitancy? Oh, because when you are unvaccinated, you are the group that is likely at risk. You are the group that is likely at risk.
Yeah. Yeah.
And then, of course, there's consequences, right? So because of the vaccine hesitancy, now we have these measles outbreaks, like we were saying in our previous episode.
Yep.
And then they cost millions to contain, especially wealthy countries where public health agencies have to track cases, quarantine people, launch emergency vaccine campaigns. It's like, we could have avoided this. This is something that is completely preventable.
I know.
A vaccine preventable disease. Think about that. Think how lucky we are that we have something to fully protect us.
Again, we're so spoiled.
Yeah.
So spoiled that we don't really know. We haven't experienced measles in this country like as common as it used to be since the vaccine came out in the 60s.
Yeah.
So now we're just like, oh, before it was all better. No, that's why a vaccine came out, because it wasn't all better.
Yeah. So a report in the CDC in 2020 said in 2019, the outbreak in New York cost $8.4 million to contain, with over 500 staff pulled into a response effort. Okay.
So if you're wanting to save money because you're doing all these cuts, you're doing all these things, all that stuff, being anti-vax is not the way to save money.
And that's how we live in the US. We're also spoiled by that. So we're not only spoiled by herd immunity and all of these things that we've already done our job. Some people do their job to protect the community, to protect others, to protect themselves and their kids.
Yeah.
But not only that, but you are spoiled that you live in the US and we have these response efforts and we have these campaigns and we have the resources to be able to act fast. Okay. However, but for a developing country, this is from the WHO in 2023, it's even worse. Measles kills about 1 in 5 infected kids in areas with poor healthcare.
That's how serious it is.
IV for rehydration therapy, nothing to control, antipyretics to control your fevers, nothing.
It's yeah. That's why I find there's no other word for it but annoying, because it's like this bratty behavior of like, I'm like, you're so ignorant for thinking about it like that, you know? Anyway, since we keep talking about that, what's a treatment? So measles has no cure. It has no magical cure, you know, other than the vaccine.
Yeah, which is not a cure. You won't even have to deal with it.
Exactly.
You don't even need a cure because you're not gonna get it.
Exactly. You know. Anyway, so there's no specific antiviral. Like you can't go and get Tamiflu for it. So you can't
Tamiflu is the antiviral for influenza.
For influenza. And we're going to get into it because then that rose the question of like, and that I know a lot of people are going to be like, well, if it's a virus, why won't Tamiflu work for it? We'll get to that. So treatment for measles focuses on, when you have it, on hydration. So fluids, oral rehydration, salts, fever control. So with your Tylenols or your Advils, what have you. And antibiotics if there is a bacterial pneumonia or ear infection. Because of course, those things will probably happen. There's a chance of it happening with your immune system lowering, trying to fight measles. And then here we go, the vitamin A supplements. So let's talk about that. The WHO recommends 200,000 IU
Units.
international units for kids over 12 months, repeated next day. And then 100,000 international units for infants, right? So
this is the WHO, World Health Organization takes into account all,
the world.
Basically, you don't want to be vitamin A deficient, okay? So that does not mean that is the treatment. You are just preventing it from being more severe if you are one of those people that are deficient in vitamin A. So let's not misconstrue that, RFK. Okay.
So what does vitamin A actually do, right? So let's just clarify this a little bit. Vitamin A isn't a virus killer, okay? It's not going to kill the measles virus. It's not. It's not an antiviral, and it does not directly attack the measles virus the way that, let's say, Tamiflu or an antiviral drug might target flu or HPV, HIV, any of those antivirals for specific viruses, right? Instead, vitamin A supports the body's own defenses in a few ways. One of the ways is it boosts epithelial barriers. So since there's so many people out there that are so gung-ho about vitamin A, let's talk about how it actually works. What is it actually doing? Again, it boosts that epithelial barrier. These are the protective linings of your skin, your lungs, your gut, and your eyes. When you have enough vitamin A, these barriers are stronger and more resistant to damage. You're seeing here how it's just helping you. It's not killing or the virus or anything like that, right? Okay. So it enhances immune function. Vitamin A helps certain immune cells, so not all of them, like T cells, work more efficiently to detect and fight infections, including measles, including that one, right? Again, this is just supportive care. This is not a cure. This is not as good as a vaccine, nowhere near it.
Yeah.
It could protect your vision. So measles can trigger severe eye damage and blindness, especially in malnourished children, as she has mentioned time and time again. Vitamin A helps protect the eyes and reduces the risk of corneal scarring and blindness. In some cases, it could reduce severity. So clinical studies show that children with adequate vitamin A levels tend to have less severe measles symptoms and are less likely to die from complications, according to an Ahmad et al. Study in 2017. Now, why is it not a cure? Because a cure would be something that kills the virus directly. Okay.
Yeah.
This is just supportive care.
It's supportive care.
Okay.
Exactly.
Like, for instance, a cure would be like an antibiotic for bacteria or an antiviral for, like, let's say, HIV. There are antivirals for HIV, for Tamiflu, for certain influenzas, etc. Vitamin A does none of that. Okay. The measles virus still invades cells, replicates, and spreads throughout the body. Vitamin A does not stop it from doing that. even with vitamin A supplementation, the body still has to fight off the virus itself. Vitamin A just makes the immune system respond like a little bit more effective, and the damage to the tissues like the lungs and the eyes a bit less severe. Okay, so think as vitamin A as giving your immune system like just a little bit of a push, to help against the fight. And that's why it's dangerous for children that are malnourished, because they may have low levels of vitamin A and then they can't properly, they don't have a proper immune response. They have a lower immune response.
And that's what the study was saying.
Exactly.
Children with normal vitamin A levels or adequate vitamin A levels were the ones that had less severe. Those children were not like given extra vitamin A during no, they measured those levels.
Right. So when does it help? Vitamin A supplementation is especially beneficial in, like she literally just said, malnourished children. They often have low vitamin E levels, which weakens immune responses and increases the risk of blindness, pneumonia, and death from measles. Children under the age of 5, the WHO recommends high-dose vitamin A for measles patients in areas where vitamin A deficiency is common. All right, so we're talking about like typically third world countries, things like that. Even in well-nourished kids, vitamin A has been shown to reduce complication rates, but again, it doesn't actually fight the virus itself. You're still at risk for getting all those other complications that measles can bring about.
You just might not have a more severe version of it.
Exactly. But all those other things like that SSPE that we talked about in the part 1, still there.
Yeah.
Vitamin A is not stopping it.
Yeah.
So why do people think that there's a cure, right? Because that's what I kept on hearing, and hence why I included it in this. There's been confusion because in some studies, giving vitamin A reduced death rates by up to 50% in severe cases. This was by Mayo Wilson et al. In 2011. That's impressive, but it's also because vitamin A reduces severe complications like pneumonia and blindness, okay? And it supports faster recovery by improving immune responses and protecting tissues. But again, it doesn't stop everything else that the virus does or could potentially do even years later.
Yeah.
Doesn't do that. It helps your body, but it's not directly killing or affecting the virus, you know? So vitamin A is like a seatbelt in a car crash. It won't stop the crash, but it could reduce the damage.
Yeah.
That's like the best analogy I could have thought of.
Yeah.
You know? So do you feel like you could never get ahead of your charting?
Imagine if I lived in a world where I never had to think about notes.
Exactly.
Freed AI enters the chat.
Yep, because it's an AI scribe that's built to free physicians everywhere from this endless note-taking of yours.
It listens, it transcribes, it writes instant clinical notes, and it even writes it in your style, which
That's
I
amazing.
think is really cool.
Oh, yeah. Because you know that sometimes AIs could sound a little weird, but not here.
And it works for different specialties too. It's not just one specific specialty. So it's across all specialties in office visits, in telehealth visits as well.
Written in your own style, and it's ready by the time that your visit is over. So all you have to do is copy it into your EHR, whichever one that is.
And don't worry, it is HIPAA compliant. Okay,
Of course.
so definitely safe and secure to use.
It only takes seconds to learn. I mean, come on. You don't have more time to learn something new.
Exactly. Over 17,000 clinicians are already using Freed AI, and that includes physicians, APPs, therapists that are basically saving 2 hours of their time charting with Freed.
Now you could just have that amazing feeling of getting home, and you don't have that looming
Over
thing
your
of
head. Pajama work.
going just to do what you want to do best, because Freed has already taken over all of that work for you.
You can start your free trial today, and no credit card is needed for the free trial.
Yep, just use code FUNNY, that's FUNNY 50, to get $50 off your first month when you subscribe. Check
Get
out
on
Freed
it.
AI. So yeah, go ahead, and I thought of this because I'm like, you know what? Let's break it down even more for like give another example for anybody that's curious about this of like, yeah, well, why can't I just take like Tamiflu?
Yeah, which is
You know?
an antiviral.
Right.
So Tamiflu, okay, also like the generic is also Tamivir, okay, is for flu. It fights the flu. It's an antiviral for influenza. Okay.
Specifically
For
influenza.
influenza.
These are different viruses.
Yes.
They're all different and they do different things. And it's like different animals. Think about it like that, you know?
So influenza uses a particular enzyme called Neuraminidase. I say that with a very heavy accent.
I'm glad that you're reading it.
Neuraminidase. Okay. So it's and basically that's how it uses this enzyme to spread from cell to cell. That's like the most simplest way that we can put it.
Yeah.
So neuraminidase helps the virus break free. So helps that like shedding, that shedding.
Yeah.
And then so that it can move on to infect more and more and more.
Yeah.
So Tamiflu blocks that enzyme. So it stops the shedding, which is why we usually recommend to start Tamiflu within the first 48 hours of symptoms onset, because that is when the virus is mostly shedding. It's not really going to be as effective if you give it 7 days down the line, because the virus has already shed what it's going to shed.
Right.
Even though Tamiflu is still, doesn't matter if you're out of the 48 hours, it is still recommended for hospitalized individuals. It is still recommended for high-risk individuals as well. So we are trying to do as much as we can to lessen that risk of developing a severe disease.
Yeah.
So again, the measles is different. It doesn't have like this neuraminidase. It's from that paramyxovirus virus family, and it does not use neuraminidase at all. So you can't just take a random antiviral like Tamiflu just because
it's a virus
and you can take it.
Doesn't work like
that. Really work like that.
Tamiflu's
Medications have
specific
modes of action.
Exactly.
Mechanisms of action.
So Tamiflu, as an example, the example that we're using is specifically made for that. So think of these like puzzle pieces, right? At least that's how I learned about it back then. A virus has a specific type of like puzzle piece, right? And then Tamiflu has that missing other piece to click onto it. Now, that's because it's Tamiflu. It was made to fit into that puzzle piece.
Yeah, and block it.
Now, you can't give an HIV antiviral and expect for that antiviral of HIV to have the same. It's going to have, let's say, 2 prongs instead of 1 prong.
Exactly.
So it's not going to go ahead and like click onto that virus because it wasn't made for it.
Exactly.
So you can't just be like, oh, it's a virus, so let me take an antiviral. It's not like bacteria that
it would just be water at that point.
Exactly.
It's not going to do anything, right?
Because some people confuse it with like, oh, if you take antibiotics, it's for all bacteria. It's different. Bacteria is different from...
composition. The composition is completely different.
Well.
And that takes me back to our biology days. We had so much fun. We did so good.
I know.
So actually measles works differently. So flu sheds and it goes and it continues to infect other cells. So measles actually like fuses, like with cell to cell, just like taking that on. Why no antivirals are yet to have worked for measles? Actually, there's no FDA approved antiviral specifically for measles. Researchers are working on some experimental drugs, but measles is a really tough virus to tackle because it spreads through your bloodstream, infects your immune cells. It causes a really high inflammatory response. And then also it kind of hijacks your immune system and causes that immune amnesia that we reviewed in episode 1. Make sure you check that out. Now, measles doesn't really rely on a single enzyme, just like flu, right? That's like the beauty in Tamiflu is that it locks on to that enzyme. So if that is blocked, the flu cannot shed.
Yeah.
Right? So that's the beauty of it. We don't have that same luck with measles. They fuse cells together into giant blobs, which are called a syncytia, and then it hijacks the immune cell for basically like a free ride around the body, like through your bloodstream, okay?
Right.
So then it suppresses your immune system so that you are more vulnerable for these secondary diseases. She's not cute.
She's not. She's
not cute.
She's a nasty, nasty bug.
Yeah.
And it's insane to me how this isn't talked more about, the immune amnesia of it all.
I know. But if you look at measles, it does talk about it, but just people focus so much on the rash. It's like when we talk about measles, people are like, oh yeah, the rash. No,
so much more than that.
So much more.
So much more.
Yeah. So this is like kind of like a really good example on why not all viruses are kind of treated the same way. And again, it's so tough. Medicine is not this like black and white, right? Like how many times do we use medications for different things? Like tirzepatide.
Yeah, exactly.
You know what I mean? A diabetic drug, and now we're using it for sleep apnea. We're using it for so many more things. Weight loss, all these things.
And then you're seeing like all these trickling things like heart disease there's a benefit to it, and hypertension, and
But when it comes to antivirals, it's really different because antivirals are really made to attack that specific thing, right? Now, obviously, let's just say there's another virus, right, in a similar family that uses neuraminidase.
Right.
Then yes, maybe potentially, but still, we would still have to test that, right?
Yeah.
So-
It's not as easy, and that's the problem. People are trying to make medicine look a little simpler than what it is.
Yeah.
Almost, with all these supplements and whatever, and it's like, there's so much to it, and everybody's so different, and the immune systems of everybody is so different.
Yeah.
That like, it's dangerous to think that. It's dangerous to think that like, just because it was like that for you, that it's gonna be like that for someone else.
Yeah.
Let's not simplify all of us. We're all very different in very different ways.
Yeah. And then also, antibiotics does not work for this either. First of
No.
all,
My
measles is a
God.
virus.
Yeah.
Okay. Antibacterials, antibiotics. Okay.
Believe it or not, I've seen it all over. Like antibiotics for
know.
measles. It's like,
It's
oh God.
crazy. Yeah, maybe if you're treating a secondary infection, okay,
Right.
by all means. But
If you got the
measles,
pneumonia from having measles,
from that amnesia, and then
Yeah.
you suffer from a secondary crazy infection, okay, yes, got it, right? Staph pneumonia is no joke, so definitely take your antibiotics. However, taking it at symptom onset is not going to do anything.
Negative.
And honestly, to keep it real simple, the structure of a virus is completely different to the structure of a bacteria.
It's a
The
completely
bacteria
different
have the wall around it. Viruses have their own shells. It's so different. It's so different.
bacteria is an actual living thing.
Yeah.
Viruses are not. Which
They're
is
scary.
Which is something that's, I know that sounds
They're just
weird.
RNA and DNA. They're just genetic. It's so crazy. They're crazy.
Guys,
They're
and I
crazy.
know when I first learned that way back when I first learned that a virus is a non-living thing, it's crazy. And I know it's a little mind-blowing and it's a little hard to understand, but that's how different it is from a bacteria to a virus. A bacteria is an actual living thing. It has a nucleus. It has all these things. It has a mind of its own, in essence. And the simplest way that I can break it down Barney style is that a bacteria has a mind of its own. It's its own little tiny little living thing.
Yeah.
Viruses are not. They're just like, think of a computer hijacking program.
Capsule with some genetic material in there.
It's literally a hijacking software system.
Yeah.
In
And
a
they
biological
use,
sense.
They use cells
To
tools
replicate.
to replicate their own DNA. That's how it works.
Exactly. But in essence, it is not a living thing. It doesn't have a nucleus. It doesn't have all it's there for is to replicate.
Yeah.
It's not like a parasite either, that a parasite is a completely living, a complete living thing too. It's just, viruses are insane.
Yeah.
The best way that I could say is that it's literally a hijacking software for like computer. Like when your computer gets a virus, that's where the term came from.
Yeah.
Literally, that's where the term came from, because it's a non-living thing that infects your computer and it fucks it all up. That's exactly where it came from.
Yeah.
So
So by all means, if you have a bacterial pneumonia, if you have ear infections, if you have a sinusitis, if you have any bacterial secondary infection, then by all means you can use an antibiotic. Okay.
yeah. So prevention, as we keep harping on it, vaccines, guys.
Yeah.
The vaccine is the best way, period. Like
Yeah,
there's
that
no
is.
other.
What is the prevention? Get
Vaccine.
the MMR vaccine.
Yeah. Anyway, so the MMR vaccine has 2 doses and it's 97% effective. Offers lifelong immunity for most people. And it works even if it's given within 72 hours of exposure.
Yep.
So it's that good. Now, herd immunity. If 95% of people are vaccinated, then measles can't spread easily. But when the coverage drops, then there will be an outbreak, which is what has happened, unfortunately. Now, the future of measles in medicine, they're trying to see if they can make like new combos, just like measles is measles, mumps, and rubella. So that's like a combo vaccine. They're trying to see if they could mix it in with the COVID. That's another one that's tested. Then there's also research going into measles antivirals like Tamiflu, but that's still undergoing research and there's nothing out there right now that you could buy for it. Then, of course, understanding immune amnesia could help fight other immune wiping viruses and whatnot. It's just insane to me how I didn't know even about the immune wiping amnesia.
Yeah.
I didn't know about it. with how much is being talked about in measles in the last month or two, didn't know a thing about it.
Yeah.
And so I really wanted to bring light to it because it's insane to me how the media has not covered that at all. So let's talk a little bit more, because we did talk about vitamin A, and now, you know, there's a whole bunch of supplements out there that people are like harping on, and they're like, well, you could take this to fight measles or whatever.
And yeah, let me also just give my 2 cents in that. When you do it under supervision of a medical provider, then yeah, the safety profile, it should be there, right? It should check out, right? If I give my kid the recommended dose of vitamin A, right, then everything should be okay. So the safety profile is okay. It's like, you know, when we're sick and we say, you know, take some vitamin C and all these things. Is it really going to stop? No, but it might help.
Right.
Maybe. Studies are kind of like, but there are studies showing that, yes, like kids that were deficient in vitamin A were more likely to suffer severe disease. Let's go ahead and make sure that you're not deficient. And again, maybe we don't have time to draw your blood and see where your vitamin A levels are, if you need it or not. But you should be careful, because there is such thing as vitamin A toxicity, which is very severe too.
Exactly.
Right. But other things, like Jules is going to mention now, like other supplements, you can also take under guidance, basically.
Exactly. So one of those things is like, let's say zinc, you know, and I know that zinc is also recommended for any type of cold. Like Zicam is the popular one that I could think of and whatnot. And it just helps your immune system, but it doesn't directly fight measles as like all of these supplements, you know. Probiotics, because it can help with your gut during recovery. And then of course multivitamins, because you don't want to be deficient in, let's say, vitamin A, which will help you out a lot.
For example, for a malnourished person.
Exactly. But remember, they help, but they're not a cure. So the latest news as of between 2024 and 2025, so the WHO declared measles a resurgent global threat. Vaccination catch-up campaigns are targeting children under 5 in Africa, travelers in Europe, and under vaccinated communities in the US. And scientists are exploring gene editing strategies to enhance immune response and possibly erase immune amnesia, which is incredibly dangerous, as we've talked about. Now, a couple of other facts that I wanted to sprinkle in before we ended it is that measles can infect 90% of unvaccinated people who are exposed. That's how contagious it is.
Yeah.
If there's a room of 10 people and you expose them to measles, then 9 out of those 10.
It's crazy.
That's how infectious and contagious it is.
Yeah.
That's insane. Anyway, measles virus can linger in the air for up to 2 hours after someone coughs, which is another reason why it's so contagious. It's like out in the air for 2 hours.
Yeah.
That's insane. And then measles wiped out 30% of Hawaii's population when European explorers brought it in the 1800s. So do we really want to go back to those days, guys?
Yeah. It just
like
goes,
this is a thing. Like this is how
and this is how these outbreaks happen, right? People travel between places. You know, the outbreak started in Texas. Then there were cases in New Jersey.
Yep.
Then there was a case in Kentucky. Now there's a case in Florida. So it's people travel, and this is a good example of like when the Europeans went to Hawaii and they brought it, and then it wiped out like
30%.
30%, which is crazy.
But yeah, we want to go back to those days where vaccines didn't exist, and you know, advancements in medicine didn't exist. Like that was better back then. Like that is my argument with like the anti-vaccine like community, and like this traditional like the traditional like lifestyle that's trending now.
But whatever. You can be traditional, right? But it has nothing. Again, it has nothing to do.
But they mix
with
it.
Medicine, with science, with everything. So even if you are traditional, even if I went and wanted to live like on a farm, like which is what I imagine like traditional, kind of mean
it's
like live on a farm. Type of thing, yeah, exactly. Away from kind of like the world, kind of secluded. You grow your own things. You eat your own things. It does not mean that you cannot go to your doctor and get vaccines to prevent you from ever getting these diseases.
It's just, to me, it's like embarrassing. You know?
I think it is embarrassing, and it's kind of sad. Yeah. It's sad because sometimes I feel like the U.S. is just getting laughed at right now, and it like pisses me off so much.
I don't know.
So much.
It's just a mess. Measles is a mess. The fact that we have a resurgence of it here in what is quote unquote a first world country is embarrassing, and it's a mess. Yeah. I just urge everyone to just get yourself educated.
From reputable sources.
Don't just lean and completely blindly trust charismatic individuals out there, whether it be politicians or social media influencers or whatever the
And for the
case
love
may
of
be.
God, have some, for the love of God, have some sensitivity.
Yeah.
Don't be this person out here being like, I'm not vaccinated my kids. It's just, it's,
You know what's
there's so much, it's so wrong.
And there's so
It's
much
so wrong.
hypocrisy in that too,
Yes.
because it's like the first people that say that those type of things, at least that I've seen, the 90% of those people that I see going hard and not having any ounce of sensitivity or empathy or anything like that, and they're just like,
It's a
my
front.
view, my view, my view.
It's a front.
When you go into their profile or who they are, it's like health and wellness and spread kindness and I'm like, you're literally doing the opposite of that.
Yeah. And it's a front. It's a front, and they like
Drives me
want
insane.
to like drive it home to them. I had a patient, a family, come in, and the family is known to not vaccinate, right? I still take care of them, okay? They came to see me all the way from, I think they live north of like Fort Lauderdale. It was a very long drive for them.
Yeah,
It was like an hour long drive.
At least, yeah.
Yeah, at least. So they came all the way to see me because the child had fever and rash. It was not measles. The rash was like not measles, right? But in the conversation, the mom was like, yeah, like with this like measles outbreak, and she immediately caught herself in her moment of fear because she is fearful about measles because, girl, no, I'm sorry, you would not drive to me.
No.
Okay?
No.
For a fever and rash, okay? Because the reason you drove to me is because you are scared, right? So she immediately catches herself. And I told her as soon as she's like, no, because with this whole entire measles outbreak, I wanted to comfort her and tell her like, no, this isn't measles, right? And she immediately, because I said that, she said, well, and even if it was measles, whatever. I'm like, if it was so whatever, then why did you come drive all this way?
The hypocrisy is something I cannot stand. I can't stand it.
Just
I can't.
admit it that you did not vaccinate and you were scared and you came to me to make sure that your kid was safe. But because of that, okay, now because I would have loved to see, and I would never wish that upon anyone, but I would have loved to see if I would have said, I'm concerned for measles. What would her reaction be? I bet you anything she'd be like, for real? Like, you think? It would not be, well, whatever.
It's truly insane to me. I don't understand it. I don't think I could ever understand it.
It's so hypocritical.
It's the hypocrisy. I cannot stand it. And I was talking about this with Mario the other day. I find it so interesting, the psychology of these type of people that are so staunchly like they have these hooks on this idea and they refuse to let go of it no matter what you throw at them.
They refuse, yeah.
And I'm like,
they'll die hard on it.
and I'm like,
I think it's more pride.
But
I think it's pride.
Why the staunch grip on something on something like this? Can you open your mind a little bit to just read?
Yeah.
To just hear something. I'm not saying to fully change your mind, but just like listen.
Yeah.
But they refuse to do it. It's like they put on these blinders and they like hook onto this idea like with their life, like their life depends on it. And I'm like, why are we like this?
Yeah.
I've never understood that. I really like, even if I don't agree with you, I like to listen to other people's point of view because maybe I learned something, or at least I learned the way that other people think, whatever. But like, why just even close yourself off to the point that you just, that to me is insane.
Yep.
I will never understand it. But anyways, that was measles, guys.
That was measles.
That was measles.
Part 1 and 2.
If you are in the anti-vax community, this is clearly not the podcast for you. And I wish you well.
Yeah. And if you're listening, then just take it as a moment to educate yourself.
Yeah.
Okay.
Yeah.
Please.
Yeah, that's it.
We're going to take it as an opportunity to learn.
Yeah, that's, I think, the point. One of the biggest things about this podcast that we decided to start doing is because we know and we've seen it, and especially in her day to day, is that medical literacy here in the US is shit.
Yeah.
It's absolute crap. People don't know how to interpret studies. People don't.
Clearly.
And other than that, just medicine as a whole sounds so taboo. It's boring. It's like it uses all these big words, so people are scared to even learn about it or don't give a crap because it's too hard, quote unquote, too hard to understand and whatever. So one of the main things why we wanted to do this podcast was to eliminate that, to like give a little bit of a more everyday understanding to all of these things.
A more
that are
relaxed
out there.
approach.
Yeah, something more
conversation.
easily digestible, you know, for
Like,
you to
really
understand a little bit
pick at
better.
your brain and like intrigue you with these things.
Exactly. It's just a conversation. It doesn't have to be a lecture. It doesn't have to be like a freaking dissertation. It's not that. It's just a conversation to like help to give you at least the data and at least the science on whatever particular topic it is. And in this case, it was measles, you know? So it's not like we have our own agenda and we're pushing it. No, I'm literally just, and that's why I included vitamin A. Yeah, it does help your immune system fight it. It doesn't kill the virus, but it does help your immune system fight it. But that's what it is. Now, will any of us tell you, hey, load up on that vitamin A right now?
Yeah.
No. I mean, I still stick to, and by everything that I've read, is that vaccine is a way to go. And by all the other research that I've seen as well, especially in autism part 1 and 2, I haven't seen a single thing that has led me to believe that it has anything to do with autism.
Yeah.
But that's based on what the information that I've gathered, and then we're presenting it to you. It's not because we have our own views or whatever. It's literally just by what she studied for many, many years and what I've been pulling to go ahead and give you guys these episodes. And together, this is what we do. Take it for what it is. And I just hope that you at least learn something new from it. And then if you have any questions, by all means, like ask us on it. And any forms of social, we're pretty much everywhere. Or if you don't want it to be like so out there and you want to be a little bit more private about it, our email,
yeah,
funnymedicine305@gmail.com. And yeah, I hope that
I hope everyone enjoyed that episode.
yeah, it's been the last two have been like heavy. It's been autism 1 and 2 and now measles 1 and 2.
And then measles, yeah, which we weren't planning on it again.
Not at all. I had to like, and now I'm going to have to switch over the schedule again because this ended up being a part 2 because there's just so much to talk about.
Yeah. And Jules and I say this every single time. We will never lose content.
Oh no,
because it's always ongoing, and
there's always something.
We did not plan this. We obviously did not know that there was going to be an outbreak, right?
No,
so
it was not in the schedule at all.
With all this fear and misinformation and all these things, we decided that it might have been a good idea to just ride that wave and really tackle measles for what it is, what can happen, how to prevent it, what can we do, what things are out there now, what people are saying, what misinformation people are saying.
Yeah.
So
definitely. So I hope that gave you guys like some more information of maybe that you were missing, maybe you didn't know, like I didn't know about those two, the SSPE, which has traumatized me now, and the immunity amnesia.
Yes.
That's something I had no idea about either, which is incredible that a virus could even do that. That's insane to me. But anyways, I hope you guys learned something about it. And follow us everywhere. And thank you guys for tuning in. We'll see you in the next one.
Bye.